Child, especially those in school-going age, they could have 6 to 8 episodes of cold in a year.
Hi everyone, welcome to Ask Me Doctor Season 2, a video series for parents to learn more about your children's health. I'm Hazel from motherhood.com.my. Common cold is very common. It's one of the most common illnesses among our children. Today I will speak to Dr. JoAnn Rajah, consultation paediatrician from ABC Children's Specialist Clinic. Hello Dr. JoAnn.
Hello, hi Hazel. Thank you for inviting me for this session.
It's good to have you. Can you share with us how do we define common cold?
As you mentioned earlier on, common cold is something so very common as the name suggests. Now, common cold is caused by various viral infections. You know, it's not a surprising thing that 50% of all cases who actually walk into the clinic do have common cold. And in a child, especially those in school-going age, they could have 6 to 8 episodes of cold in a year, and we still consider that as something normal. But they tend to outgrow this as they grow bigger as well.
Dr. JoAnn, what are the causes of common cold?
For common cold is caused by viruses, so that's very important, yeah? So it's not caused by bacteria but viruses. And when we talk about viruses, unfortunately, there are more than 200 viruses that can cause a common cold. So out of these viruses, rhinovirus is the one that is responsible for mainly 30 to 50% of the cases most of the time. Now, there are also other viruses which are quite common. For example, respiratory syncytial virus, so for short RSV, coronavirus. Now, this is not the coronavirus which is causing the current COVID-19 pandemic, yeah? Not that one, all right? Of course, we have other things like enterovirus, and the list goes on.
It affects our daily lives. How can I treat my child with cold?
The common cold is caused by viruses. So actually, in terms of viruses, there's no specific treatment for it. The main aim is basically to reduce the symptoms which is associated with the common cold. That would mean you want to help to relieve your child or help them to cope against sneezing, runny nose, coughing, etc. Things like that. So what are some of the sort of like home remedies which are simple but very, very important to do is, number one, to ensure that your child is always well hydrated. Whenever your child is down with a cold, due to the nasal stuffiness, they will naturally lose appetite to eat. However, it's very important to ensure that they're drinking fluids frequently and remain well hydrated. Now, the next problem would be when they want to sleep. Yeah, can you imagine if you're having a runny nose or stuffy nose, as soon as you lie down, you will realize that it's so hard to breathe. So propping them up with an extra pillow does help, right? And for thirdly, if let's say your child has throat irritation, they start coughing, giving them a little bit of honey before they sleep at night would be actually quite beneficial. But do bear in mind that for children under the age of 1 year old, giving honey is not encouraged because of the fear of a bacterial infection called botulism.
I'm sure some parents will also Google this, what are the treatments, home remedy, and one of the things that came out of the result is chicken soup. So does it really help?
So this is actually very interesting actually. I've also heard about this natural remedy before, and I did my homework. So basically I went through a few clinical studies, and surprisingly people actually, sort of like tested to see whether giving chicken soup actually helps in a common cold. And the answer surprisingly is yes, yeah? Surprisingly, chicken soup does help you to reduce the nasal stuffiness, so the child feels much better. But I think the practical aspect in this is because, when you're having a common cold, you might not have enough appetite. So drinking chicken soup is something that is more palatable and easier to be swallowed as well.
Dr. JoAnn, would you recommend, is there any specific treatment that can help my child to relieve the cold?
When we talk about the specific treatment for a common cold, once again is to relieve the symptoms. So definitely spraying a saline spray or a saline drop into the nose would definitely help, not only to clear the mucus, to decongest the nose, but it actually helps to flush out virus from the nose as well. So indirectly, that sort of like shorten the duration or the severity of the cold, which is a good thing. Now, the next thing that parents can do is, of course, spraying nasal decongestants into the nose. Now, nasal decongestants, what do? Is they help to dry up the mucus in the nose, so relieving the symptoms a bit more faster. And of course, we do have oral antihistamines or flu medicines to be given. Alright, and this antihistamines does help you to dry the nose, to decongest the nose. But I would like to just caution parents in giving antihistamines, do ensure that for children under the age of 2 years old, always choose a non-sedating antihistamine. Not all antihistamines can be given to children under the age of 2 years old. So it's very good to discuss with your doctor first beforehand, before buying flu medicine over the counter.
Dr. JoAnn, is there a difference between common cold and flu?
Definitely there is, and it's a big difference. Now when we talk about common cold, we are actually referring to the 200 viruses said earlier. But when we talk about flu is specifically about influenza infection. Yeah? So influenza is a virus whereby one of the commonest symptoms that it can cause in a child is a high-grade fever, a persistent temperature more than 38 Celsius, which can even rise up to 40 Celsius, which generally lasts for 3 to 4 days. And in influenza or in a flu, the child technically appears rather ill and unwell, and symptoms such as headache, muscle pain also is rather common, as well as symptoms of upper respiratory tract, for example, sneezing, your runny nose, your nasal congestion. But what's very interesting in influenza is the cough. Now the cough tends to be very dry, very persistent, and is rather painful, and even some of my younger patients can actually say that it hurts when they cough. So it causes a very bad painful cough. And of course, what we are worried about is the complications from a flu, which is lung infection, and in certain cases it can cause brain inflammation. Between the both of them, in terms of flu, there are certain things that you can take to shorten the duration of illness, which would be antivirals, which you do not need in a common cold. But the good thing about flu is it's preventable through vaccination. So as we are approaching the end of the year, so it's very important for all parents to take this opportunity to get their children vaccinated against the flu. Prevention is always better than cure.
So for common cold, how do I know if it's getting severe, that I should go to a doctor, go to a hospital?
Definitely, that's a very important question, because of course, at the start of the runny nose or the start of the sneezing, you might want to do some home remedies, and to see whether your child actually recovers from it by himself or herself. But once the common cold symptoms becomes prolonged, more than 10 days, especially if it's associated with very atypical other symptoms, for example, high temperatures, more than 38, alright? Persistent greenish or yellowish discharge from the nose, so that's rather peculiar, or headache or a facial pain, a severe ear pain, any difficulty in breathing, or a child that appears very tired, more tired than usual, then I suggest that you bring your child to be examined by a doctor.
If my child have common cold, can he or she still go to the school? Would it be a risk that he might be spreading the virus to others?
Irregardless whether we are in the midst of a COVID pandemic or not, a flu virus is definitely very contagious. If your child is having sneezing episodes, coughing, runny nose, things like that, it is best to keep them at home, because yes, it can spread. And not only that, the main reason why we want children to stay at home is to also get the rest that they deserve.
So for flu, the best way is through vaccination.
Yes.
For cold, what's the best way to prevent?
Once again, in the cold, there's no vaccination for it. So of course, you want to take precautionary measures. And the precautionary measures are almost similar to what we are actually doing right now in the midst of the COVID pandemic. So that would be frequent hand washing, especially after touching multiple surfaces, or after sneezing or coughing, and before eating. Alright? Other than that, definitely never ever touch your eyes, your nose, your mouth, especially if you have not washed your hands, because all these sites are the portal of entry for the viruses into the body. Other than that, of course, wearing a mask is very important, and thanks to mask wearing and social distancing, we actually have seen a significant drop in the number of children having common cold.
So before we close, is there anything else you would like to add on?
As we have talked earlier on, common cold is very common. Yeah, it's so common that your child can have 6 to 8 episodes of common cold in a year. So don't panic. There's nothing wrong with your child's immune system. But what's more important, if let's say you want to prevent your child from getting a common cold or being sick altogether, to ensure that they're eating a well and healthy diet. So that's very important. Make sure that they get enough exercise, because exercising has been shown to actually boost up your immune system. And of course, number 3 is do take all the precautionary measures that doctors and basically our health ministry has been advising throughout this COVID pandemic.
Thank you, Dr. JoAnn, for answering our questions today. For more videos about our children's health, stay tuned for Ask Me Doctor Season 2. I'm Hazel. See you.